The People's National Congress Reform is calling out the government on what the party called the mismanagement of the COVID-19 pandemic. At the party's press conference today, former Junior Minister of Public Health Dr. Karen Cummins said the People's National Congress Reform expresses grave concern that the COVID-19 pandemic is being totally mishandled by the government.
The actions of the government are causing more deaths, more infections, and more hospitalizations of our citizens. This is due primarily to its abandonment of the coalition's effective COVID-19 plan that it inherited, and its determination not to have any bipartisan approach to managing this pandemic. Guyana, being now classified with the highest restriction on travel, Tier 4, as announced by the Center for Disease Control of the United States of America.
She then called out the Minister of Health, Dr. Frank Anthony, to provide details on the following questions.
How many free PCR testing sites are there in Guyana, and where are they located? What are the variants of the COVID-19 present in Guyana? What is the infection rate among our citizens? How many vaccinated persons have died from COVID-19? How many children there are and have been infected with COVID-19 and would have died? How many AstraZeneca, Pfizer, and Sputnik V vaccines have been received to date? And how many persons have received first dose and the second doses? Is there a national register for the collection of data on adverse effects from the vaccine? How many persons who have underlying conditions receive vaccinations? Where can persons with underlying conditions receive an exemption certificate from being vaccinated? How many ICU beds are there? And how many trained ICU nurses are employed?
Further, the PNCR called on the government once again to take politics out of health and have a national stakeholder approach that will result in no deaths, less infections, and less hospitalizations.